So sorry about that disconnect, and I apologize if this is a repeat. The doctors stopped prescribing hormone replacement therapy as a result of the highly publicized link between the use of it and an increased risk of breast cancer and heart disease. And the shift away from hormone replacement therapy showed us that cancer can be greatly impacted, cancer trends can be greatly impacted by changing what the medical community considers standard. And this is an important concept, that if we can get medical doctors to change their thought process, if we can get society to change its thought process, then we can actually reduce the risk substantially more. Now, there are unavoidable risk factors. You absolutely cannot escape the risk factor for being born female. You cannot escape the risk factor for having the BRCA gene, which means with that gene, you have a 50 to 85% risk of developing breast cancer by age 70, and a 40 to 60% risk of developing ovarian cancer by age 85. You can't escape the risk of getting older. 1 out of 8 invasive breast cancers occurs in women younger than 45, and 2 out of 3 occur in women older than 55. If you have a personal or family history of breast cancer, a first-degree relative, mother, sister, daughter with breast cancer, this will double your risk. If you have 2 close family members, first-degree family members with breast cancer, it triples your risk. High-density breasts will double your risk. Actually, I take that back. Not double it, but raise your risk. Beginning to menstruate before age 12. Now, this is and is not an unavoidable risk factor. Some of this is genetic, but some of this is also environmental. Cooking on plastic, cooking in plastic, microwaving in plastic, using plastic water bottles and having them get overly hot will release estrogens into the water. Freezing a water bottle to have it colder or stay cold longer will also produce estrogens that you consume. Meats, in particular here in North America, they seem to love giving estrogen to chickens and to beef to fatten it up faster so it can go to market sooner and save them money. Those estrogens end up in our children, and it enables them to start menstruating at earlier ages, to go through menses at much earlier ages. So avoiding estrogens in your foods, avoiding estrogens by avoiding cooking and plastics are avoidable risk factors, although sometimes this is genetic and in families. Starting menopause after the age of 55, also somewhat unavoidable. Having had breast cancer in the past, the risk of getting breast cancer in the other breast as a new cancer is 3 to 4 times higher if you've had breast cancer before. And we're not talking about recurrence of cancer on the other side. We're talking about a new cancer on the other side. Radiation. Again, this is a treatment that comes with cost. Radiation for Hodgkin's lymphoma in childhood would save your life as a child, but it sets you up for developing breast cancer as an adult. DES exposure. DES was an artificial estrogen used in the 1950s and 60s for preventing miscarriages, but also for preventing morning sickness. And a lot of the women who had DES have daughters who developed, well, they had developmental issues with their vagina or their uterus, but they also were higher risk for cervical cancer, vaginal cancer, and breast cancer. And let's see, moving on to lifestyle choices. Having a full-term pregnancy after the age of 30 will raise your risk. Having never had a child or been pregnant will raise your risk. And becoming obese after menopause raises your risk. So these are things that are sometimes choice, sometimes not choice. Bottom line, though, with pregnancy, you can reduce your risk of breast cancer to some extent if you breastfeed. The longer you breastfeed your children, the lower your risk. The World Health Organization recommends breastfeeding a child for up to 24 months. And different literature in different countries recommends anything from 3 months to 12 months. 3 months is good for the child because they don't have a developed immune system, so you're conveying immunity to them. 12 months is good for child and mom. 24 months is really good for mom. Risk factors that you absolutely have a choice about include the use of hormone replacement therapy and birth control. Hormone replacement therapy we've discussed, but some women still go on it because they have severe menopausal symptoms. In the case of severe menopausal symptoms, I would strongly suggest that prior to considering hormone replacement therapy, you have your doctor check you for your vitamin D levels, because low vitamin D levels reflect with menopausal symptoms, because vitamin D is an estrogen regulator. Using birth control. Now this is interesting. If you use birth control consistently for more than 12 years, it will raise your risk for breast cancer. But if you've been off of birth control for more than 10 years, it returns you to a baseline risk. Now, the Women's Health Initiative established that not only was hormone replacement therapy not good for heart health, that it actually was killing women, which is why they killed the study mid-study. In 2004, the Danish nurse cohort evaluated European nurses in much the same way that the Women's Health Initiative had done it in the US. And they established that that you definitely reduce risk of breast cancer with no hormone replacement therapy. Women who take it have a higher risk. Now, there are other studies linking obesity and hormone replacement therapy use to risk, and we're going to come back to obesity in just a minute. Reducing the prescription of hormone replacement therapy, and I've said this, I'll say it again, is huge, because it reduced breast cancer in all the high-income countries that it was being used in. The breast cancer rate went up, and when they stopped prescribing it, the breast cancer rate went down. If we could get doctors on board with other risk preventatives, the way they got on board with hormone replacement therapy, we could do a lot with breast cancer. We could reduce the risk substantially. Unfortunately, they got on board with hormone replacement therapy. They got on board with prescribing it because there was money to be made by pharmaceutical companies, and so they really marketed it hard and fast to the public and to doctors. But they got off of prescribing it because of the liability associated with the deaths. The most disturbing part about hormone replacement therapy was it was being advocated as a way to protect heart health in women. There were never any studies done on this, and if anything, it was actually killing the women by giving them heart attacks when they were on it. Okay, so some of the things that it would be great if we could get doctors on board about would be stopping smoking. One recent study suggested that women who were exposed to cigarette smoke, either actively because they're the smoker or passively because they live in the house with a smoker, are much higher risk of getting breast cancer. Another study published around the same time said that the effect of cigarette smoking on breast cancer risk was related to time of exposure. So when you start smoking at a younger age, you definitely have a higher risk for developing breast cancer. Okay, here again, if we get society on board with this, and if we could get doctors on board with this, this would be golden. But we have very large companies, very large food syndicates and beverage syndicates spending very large amounts of money advocating that we should eat their products, and we don't have the budget to change these marketing strategies. And so the consequence of that is that first world countries have this huge explosion in obesity. More than half of the planet's obese people live in 10 countries. This is staggering. Young women in the UK are heavier than anywhere else in Western Europe, with 1 in 12 being clinically obese. And over 8% of females in the UK under age 20 are obese, and almost 20, well, actually more than 29%, almost 30% are overweight. And this was research recently published in the Lancet Medical Journal. Unhealthy food choices obviously have a lot to do with obesity. And we talk about white foods here, the non-nutritive foods that are fully carb-loaded, carbohydrate-loaded. Your breads, your pastas, your rices, ice cream. I mean, there's just not a lot of nutrition to these foods, but they will sure pack the weight on you if you consume them. Soda, this is another thing, I didn't write it on the list, but soda, you can actually, 1 soda a day, 1 8-ounce soda a day, or will actually put 5 pounds a year on you. Fatty foods, and then the overconsumption of grilled, barbecued, and smoked meats. Basically, the black charring on a meat is nitrates, and nitrates create cancer. Not eating enough fruits and vegetables, not getting the antioxidants from those fruits and vegetables will raise your risk. Now, all of these unhealthy food choices are avoidable risk factors for breast cancer, aren't they? And if we could just get society to figure this out, that we're better off processing our foods less, eating more fruits and vegetables, 7 to 9 servings a day would be optimal, that you can actually seriously reduce your risk for breast cancer. So choosing the healthiest lifestyle, you empower yourself. And right now that's about the only way you can do it, because it's not become endemic the same way reducing hormone replacement therapy has. Now, this is an interesting article I found in The Guardian, dated September 24th. Women who go up a skirt size every 10 years between their mid-20s and mid-60s are at a third greater risk of developing breast cancer after menopause. And while BMI was known to be a risk factor, this is the first study to look at how your waist thickens over time and your risk of breast cancer. So this was a UCL University College London study that says 2 skirt sizes every 10 years gives you a 77% greater risk of developing breast cancer. Remember, 1 skirt size over every decade is a 33% risk, but 2 skirt sizes, 77% risk of breast cancer. Again, this comes back to those healthy choices, healthy eating choices. Now, in terms of beverages, I touched on soda, but another risk factor that's avoidable is alcohol consumption. If you drink no alcohol or 1 drink a day, you're fine. I mean, very, very small risk in those who consume 1 drink a day. No drinks a day, obviously good baseline there. But if you consume 2 to 5 drinks a day, this raises your risk of breast cancer 1.5 times. And it also raises your risk of other cancers. So something to think about. 2 to 5 drinks a day, not a good choice. Okay, not exercising. Excuse me, also not a good choice. Evidence is growing that physical activity actually can reduce your risk of breast cancer. And one study from the Women's Health Initiative, before it was pulled, says as little as 1.25 to 2.5 hours a week of brisk walking reduce your risk by 18%. Some emerging risks that science has known about for a while, that doctors may know about, but nobody's doing much with, include something very simple: vitamin D. Vitamin D is an estrogen regulator, and we know that women who have lower levels of vitamin D have a higher risk of breast cancer. In the United States, 70% of the population is vitamin D deficient. We know here that 98% of breast cancer patients are vitamin D deficient. So this is a significant, statistically significant number to have 98% of women with breast cancer have low levels of vitamin D. So one of the things we're also learning is that women with breast cancer undergoing treatment for breast cancer may actually be more responsive to their treatment if their vitamin D levels are normal. And yet, even in this population of patients, I don't see that vitamin D levels are routinely and regularly tested. There was very recently a study on the BRCA, the BRCA gene, and these women have the lowest rate of response to breast cancer treatment. Interestingly enough, when they are given adequate amounts of vitamin D, they respond better to treatment also. So not only is vitamin D recognized as an estrogen regulator, but it is being identified as playing a role in controlling the rates of normal breast cell growth, but actually being able to stop breast cancer cells from growing. There are studies saying that out of the body in petri dishes, when they are using vitamin D, it stops breast cancer cell growth flat. And if that translates to the human body, that means that having good levels of vitamin D not only reduces your risk of breast cancer, but means that you will respond better to treatment for breast cancer if you've been diagnosed. If the normal level of vitamin D is between 30 and 100 nanograms per milliliter, the average level for women with breast cancer was just 17. Now, and this just talks about the fact that it may well be that vitamin D could be promoting the death of cancer cells, and this is something that is being researched right now. Bottom line, any woman diagnosed with breast cancer or who has family members diagnosed with breast cancer should be having her vitamin D levels checked regularly. If it's normal, you can look at being checked annually. If there's no cancer risk in your family, nobody's had it, I would still get checked annually. But if it's low, my suggestion is being checked every 3 months because of seasonal changes. For instance, if you're tested in the summer and you come in either low or low normal and you're getting some sunlight in the summer and then you bundle up in the winter and you're not getting outside as much, your levels can go even lower. And so maybe you start taking a dose in the summer of vitamin D to bring your levels into range, and you're taking that same dose in the winter, and now your levels go low again because you're getting less sunlight. So monitoring your dose rather than assuming it's okay is beneficial. And because it is a fat-soluble vitamin, it should be monitored. Taking high levels of vitamin D without knowing your status can lead to vitamin D toxicity, and you don't want that. So take the guesswork out of it by having your doctor do the test. Vitamin D sources include sunlight, salmon, tuna, sardines, flatfish like sole and flounder, vitamin D fortified milk, vitamin D fortified cereal, and I'm going to say please read the label on that cereal because we don't want it to be candy in a box for breakfast that is vitamin D fortified. We want it to be nutritious cereal if that's going to be consumed. Pork, eggs, mushrooms, beef liver, and ricotta cheese. These are some of the top vitamin D sources. Now, sunlight is problematic because we have dermatologists telling us wear sunscreen, wear sunblock. And when you wear sunscreen and sunblock, you don't get the vitamin D that you should be getting. So, finding that balance, getting some sunlight 20 to 30 minutes a day without sunscreen and then applying the sunscreen, your dermatologist may not be happy, but your body will be. Now, iodine. People don't think about iodine, and yet this is another very simple test that can be done and a very important level that should be checked. In the US, grains used to be iodized. When they would make breads or baked goods, the grains that were used were iodized. But in recent years, manufacturing has turned to bromination. Instead of using iodine, they use bromine. Bromine will impact the thyroid, and this is another day's conversation. It'll impact the thyroid in a negative way. But basically, your breast tissue, like your thyroid, need iodine. And we're not completely sure why breast tissue needs iodine, but we know that it is so important that if you're low on iodine, your breast tissue will steal iodine from your thyroid gland to keep your breast tissue healthy. Okay? So in the US, as I said, and I can't speak for England, I don't know what the processing is like there, but grains here are now brominated rather than iodized. And so we're not getting iodine in our breads and grains anymore. We're also not getting it in our salt, because sea salt and kosher salt and even table salt are no longer routinely iodized. And so we have this quiet epidemic of iodine deficiency occurring in the US, and it may be occurring in the EU also. Iodine deficiency will cause low levels of thyroid. It'll cause you to stop ovulating. It can cause infertility issues and autoimmune issues with the thyroid. It can also increase your risk of thyroid, breast, uterine, and ovarian cancer. Interestingly enough, if you are low on iodine and you have hypothyroid symptoms and your doctor puts you on Synthroid or another form of artificial T4, this can actually aggravate your response to your lower iodine and may increase breast cancer risk even more. As I said before, iodine is so important for breast health that the female body will steal iodine from the thyroid to keep breast tissue levels high enough to protect the tissue at the expense of thyroid function. So monitoring this level, if you're at risk for cancer, like monitoring your vitamin D, is a simple way of trying to beat the odds. You get iodine from sea vegetables like seaweed and kelp, from seafood, dairy, and eggs. Other risk factors you can control for: phthalates and parabens. These are found in things like nail polish, hairspray, personal care products, toys, vinyl flooring, packaged foods, cleaning products. Parabens, these are in cosmetics. And when they are absorbed through the skin, these things will act to affect estrogen. I do some testing for those here. I do urine testing, and in this country it's not always insurance reimbursable, but if I've got patients who are at high risk for breast cancer, this is testing that we do if they have concerns about exposure to parabens or phthalates. And that's it. Any questions? Well, I think we're done then. Hello?
Yep, I don't think there's any questions.
Okay.
Well, that was really a good presentation, and I'm sure a lot of people will be interested to watch the replay.
Okay. Well, hopefully, hopefully I didn't repeat too much.
No,
you could figure it out.
Like I say, I'll edit it.
Okay.
The slides did, like what we're talking right now, I'll take off of there. But the slideshow locked up too. But that's okay. I think it was an excellent presentation. And we should probably, at some point in a few weeks, when your time is freed up, go over it again from start to finish without any glitches or anything.
Sure.
And we'll do it from my computer. Colin has problems. He has a really bad connection where he lives, and I've been making him the presenter, which means if he's the one that logs on as the administrator, if he drops for any reason, it messes all us up.
Sure.
So
now, where are you located?
I'm in Naples, Florida.
Oh, you are? Okay.
Yeah.
Okay.
So
Yeah. Well, maybe we could do this.
and plus we can stage these without any live people, and then because I have the ability, we can replay these, but as live, and then have people ask questions. We'll say at some time we could send you a bunch of questions that people wanted answered, and then just have this incorporated into the recording.
Okay. Yeah. It wouldn't be this weekend, but next weekend I don't have children, and maybe on Saturday morning early or something like that, or
Sure.
Jenny, how do you manage to have no children? Apologies, I had to shoot out there. My wife was delayed
that?
picking my youngest one up. I had to shoot out and pick my youngest one up because
Okay.
my wife was delayed for half an hour. But how do you manage to get a weekend with no children?
Divorce.
But that's not a suggestion for people.
No, wouldn't recommend it.
No.
So, yeah, but and then I could have a quiet hour to just kind of reproduce this. I'm thinking I wrote more than 30 minutes, so yeah, I mean I wouldn't mind giving you a cleaner copy unless you think you can cut it together and make it work. If the slides froze up, do you need the slides too?
It might not be a bad idea, but if we're going to redo it,
Yeah.
what we'll do is before we start recording, we'll actually practice it and go through all the slides from front, real quick in succession, and that way I can give you feedback. Okay, yeah, it is working. It didn't lock up there, or it's fine, or whatever, and we'll just test it first. That's all.
Okay.
I'm not sure why. Maybe because it had changed your format or something. That's what caused it to stop. I'm not sure.
I'm not sure. So, yeah, so I would suggest if 8 o'clock or 8:30.
It's fine with me.
Sunday?
Huh?
Does that work for you?
Oh yeah, I'll make it work. Sunday's no good because I'm behind the camera on Sunday, but
Okay.
Saturday's fine.
Okay. Well, Colin, if you want to give Sandy my phone, not my phone number, my email, and then maybe we can coordinate the time.
I will do that, Jenny. Jenny, I appreciate your time. I really do. If
No
you check in
problem.
your spam, you might have something to do with the your own website and that. But what I'll do is I'll make sure by Monday you have all the details for your own personal website for community health commitment, and you'll have your own back office, and you'll see all the videos, etc., etc. So
I'm embarrassed to admit this, but I think it's in my inbox. I've just been very, very busy and haven't opened it. Well, I've opened it. Well, hang on.
Well,
No,
to be
that's
honest,
not it.
Jenny, don't worry too much about it because we're having one or two issues with our payment, our payment for people signing on as members. And I envisage worst case scenario that will be sorted by Monday.
Okay, so I won't worry about it. Well, I won't be able to worry about it until next weekend anyway.
No, that's right.
Because as I said, I'll be gone through Wednesday. Okay, well, let me know if there's anything else I need to do, and otherwise I'll just plan on redoing this on a week from Saturday.
Yeah, sounds good.
Okay? All right.
Good, Jenny, very much appreciated.
Thanks. Okay, bye-bye.
Bye.
Nice meeting you. Colin, you can stop the recording, but we should talk for a minute.
Okie doke.
Good.